Hi, I'm Alicia. I want to talk to you about breast cancer. I'm sure a lot of you have already heard of the disease, but there are many risk factors and facts about it I'm sure you haven't heard of. For example, it affects men and women. Caucasian women are more likely to die from it than African American women. 70% of all invasive breast cancer diagnoses occur in women 50 or older. Women in their 40s account for only 70% of diagnoses. However, breast cancer can and will strike women of any age. Breast cancer is cancer originating from the breast. Worldwide, breast cancer comprises 10.4% of all incidences among women, making it the most common type of non-skin cancer in women and the fifth most common cause of cancer death. Breast cancer is about 100 more times more common in women than in men, although men tend to have poorer outcomes due to delay in diagnosis. Prognosis and survival rate varies greatly depending on cancer type and staging. With best treatment and depending on staging, 10-year free, disease-free survival varies from 98% to 10%. Treatment includes surgery, drugs, hormonal therapy, and chemotherapy, and radiation. The primary epidemiologic and risk factors that have been identified are sex, age, lack of childbearing or breastfeeding, higher hormone levels, race and economic status. In Food, Nutrition, Physical Activity, and the Prevention of Cancer, A Global Perspective, 2007 report by American Institute for Cancer Research and World Cancer Research Fund concluded women can reduce their risk by maintaining a healthy weight, drinking less alcohol, being physically active, and breastfeeding their children. Several studies have found that black women in the U.S. are more likely to die from breast cancer, even though white men are more likely to be diagnosed with the disease. A risk factor is anything that increases a person's chance of getting a disease. Different cancers have different risk factors. One risk factor is getting older. Your risk for breast cancer can increase as you age. About 77% of all women diagnosed with breast cancer each year are over age 50, and about half are age 65 and older. Having a mother, sister, or daughter, first-degree relative, who has breast cancer puts you at higher risk for a disease. Having one first-degree relative with breast cancer approximately doubles a woman's risk. Having two first-degree relatives increases her risk fivefold. Having a male blood relative with breast cancer will also increase a woman's risk of getting the disease. Having your first child after age 35 and never having children puts you at a higher risk. If you have menopause after age 55, your risk increases. A family history of cancer in the ovaries, cervix, uterus, or colon increases your risk. Your risk increases if you get a period before age 12. Female descendants of Eastern and Central European Jews, Aztecs, are at an increased risk. Use of alcohol is linked to the increased risk of developing breast cancer. Compared with non-drinkers, women who consume one alcoholic drink a day have a very small increase in risk, and those who have 2 to 5 drinks a day have about 1.5 times the risk of women who drink no alcohol. Caucasian women are slightly higher at risk of developing breast cancer than are African American, Asian, Hispanic, Native American women. The exception to this is African Americans are more likely to have breast cancer than the Caucasians under the age 40. Being overweight with excess calorie and fat intake increases your risk. There are several organizations that sponsor the research for breast cancer, which include Yoplait, American Airlines, Ask.com, Bank of America, Ford Division, New Balance Athletic, New Balance Shoes Incorporated, and Remax. There are several things you can do to help this cause, such as donating funds, becoming an activist, participating in events, and buying products whose proceeds go to finding a cure. One of the truly helpful things you can do is support. Many women and men who are diagnosed with breast cancer feel trapped and alone. They might not even tell anyone about